got pins and needles in my throat, could barely speak, got chills. And another business partner asked me if he should take over. So I had to give it over to him to take over because I was not feeling well. I actually went on to MD Live, MD Live telehealth, right? Convenience of your own phone, saw a provider within minutes or seconds rather, what we thought was the flu. It was going around. So got a couple prescriptions, maybe $4, 10 steps away from my house at the pharmacy. In the middle of the night, about 4 a.m., could not keep a fever of 103 degrees down. Thought I got to go to the hospital, but why not? I'll try MD Live, 4 o'clock in the morning. Lo and behold, within minutes, I was able to get a hold of a provider within minutes, talking to a provider. And again, thought it was the flu. It was going around. Got a couple prescriptions to a 24-hour pharmacy, but suggested because of my symptoms to go to urgent care and be seen in person. It sounded like the flu, couple things off. Went to urgent care, got a series of tests done. They send me directly to the emergency room. So we know something's wrong, just don't know what, right? I go into the hospital, emergency room, give them my health sharing card, looks just like an insurance card, has an EDI number on the back of the card, recognizes commercial insurance. Went in the back, got a CT scan done. The provider gets the results of the CT scan and his whole presentation changes. Comes around the bed, sits next to me. We know when an ED doc sits next to you in an emergency room, it's never good news, right? He said, I have an appendicitis and I need to go into emergency surgery. The kicker was, he's like, but we're not sure if we take your insurance. So we're going to have to wait to see what hospital we need to submit you to. People don't realize they don't have to take you. Emergency surgery, appendicitis, and you're going to have to wait. So all they had to do was call the number on the back of the card. When I relayed that message back to registration, I've been in the trenches. I've never seen it happen so fast. Met the surgeon, went into pre-op, went into surgery. When they went into surgery, not only do I have an appendicitis, oh, by the way, you're 3% of the population where your insides are not like normal people, but you also have an ovarian cyst that had burst and internally bleeding as well. So not fun, right? 4 or 5 incisions later, but that streamlined experience itself, guys, I went in around 4:40, came out around 7:40, was able to sleep in my own bed that night. I've been in the trenches. I've seen way too many patients being discharged because of lack of insurance or lack of resources. That streamlined experience itself was so eye-opening for me. I mean, we're saving lives. What if they did need a pre-approval? What if they did need to wait to see what hospital they need me to submit me to? What if they did? I mean, anything could have happened. It could have been the surgeon could have had to wait if they weren't a general and OB surgeon. We would have had to wait in surgery for another surgeon to come for the ovarian cyst. I mean, anything could have happened, right? But I was more excited, guys, when I saw my bill. Says no one, right? Who gets excited when they see bills? I was excited when I saw my bill. Why? Because we all know that hospitals love to charge for everything, but in traditional insurance, you got to cough up that deductible before it even kicks in, right? So I haven't met my $2,500 deductible. And let me make sure I'm on the right bill here. I get my first bill of $1,229. I have not met my $2,500 PRA, which is synonymous to deductible, primary responsibility amount. So I'm thinking I got to cough it up. But no, because we're with Impact, they negotiate a lower rate, average of 72 to 75% savings. I saved $971.85. I'm only responsible for $257.15, and that's what goes towards my deductible or PRA here. Like, this doesn't happen in the space. I'm only responsible for $257.15. Oh, wait, I get a bigger bill. We know hospitals love to charge for everything. I'm Hoag Hospital, Newport Beach, guys, look. And they recharge for multiple things. $36,643.15. Because I'm with Impact, we don't have to pay dividends or investors. I saved $27,236.93. My bill is now $9,406.22. And I'm only responsible for $1,075.63. That profit of $27,236.93, where do you think that goes?
To build more hospitals?
The insurance companies. Robbery, right? 87% of people don't even meet their deductible. Number one reason for bankruptcy is what? Medical bills. So we are at the forefront of something that needs to be shared with everybody. So that, as you can tell, I don't believe in accidents or coincidences, because if I was with traditional health insurance, I had a $10,000 deductible and a 30/70 share. Guys, I would have been out within 24 hours, out $20,000 with my deductible and 30/70 share. So am I excited about what we have to be on this crusade to share? Absolutely am. And do I get excited to share it? Absolutely, because we got to get out of our own ways. I've seen how broken the system is, and I've seen how important, because of my own experience, which my team will say they're grateful for my opportunity that I had because of my conviction now, right? And how fast we're growing as a team because of Impact, and because it's a systemic disruptor. What we have here is just the evolution. We're at the beginning of the evolution of where healthcare really should be going. Anyhow, I'll get off my soapbox and give it back to Money May here, because as you can tell, I get excited and very passionate about what we have here, and excited to partner with you all, because you know what, the more people hear about it, the more people we're helping save lives, and the more people have less fear of using their health insurance to get the care that they need when they need it at an affordable rate. I'll give it back to you, May. Thanks.
Everybody's so afraid to go in for anything because they know it's going to be catastrophic financially.